My name is Dr. Jessica Olen, and I work for Welia Health. I typically work in the ER, but for the past 5 months, I've had the honor and unique experience of managing area COVID patients who can be safely managed at home, either by phone or virtually by video conference, mostly between Kennebec County and Pine County. And to date, I've managed approximately 35 COVID patients. As an organization, we wanted to thank you for your patience with us as we got set up and planned to handle COVID and had to basically put a pause on several services that we offer normally for a few months, and now have returned to nearly normal functioning at our facility, if not totally normal, excluding door screening and pre-op COVID testing, and maybe some visitor limitations at times and requests that you wear masks. And so thank you so much for being your faithful patient base and your patience with us, and we welcome you back. Our goal today is to talk a little bit about some common questions that you might have as you move forward into daily life and trying to reestablish some level of normalcy this fall and winter, with COVID in the background and it having clear effects on our choices. So I do have a PowerPoint that I'm going to use as a guide to talk about some common questions that you may have. So if you just give me 1 second, I'll change my screen here and share my background on my desktop. So the title of our talk today is Living in a COVID-19 World, Some Common Questions and Answers with Dr. Jessica Olen. And first of all, let's talk about testing. I'm sure that the majority of our patient base at this point maybe understands what we have to offer by way of COVID-19 testing. But some common questions about testing might be, number one, how is it performed and how long will it be before you know the results? So right now, we do offer robust community testing for anyone with symptoms, anyone with a COVID exposure, anyone who needs COVID testing for travel or returning to college, or perhaps if requested by their employer, if there's an outbreak or cases at their workplace. Basically, our take on testing is that we would like to make sure that the community has access to testing because it's the best way to allow the community to function as safely and normally as possible, because the more positive cases we can identify, the safer we can all be. And so the more we test, the better off we'll be. So we do encourage you to test and frankly, test often if you need to, and that's okay. And we have the ability to offer those services. So for normal community testing in those instances, and you just want to come in and have a nurse COVID test, the swab is either going to be done into the nose or into the throat. It looks for viral DNA for the novel coronavirus. And it's a very good test. It's especially good during acute illness when you're having symptoms. Specifically, it works the very best from days 3 to 5. Of illness, but it is very good during the first week of illness in general. A positive COVID test in this instance is nearly 99% guaranteed, very reliable. You should assume that you have COVID. It is very real if it's positive. If it's negative, on the other hand, that is reassuring, but not a guarantee that you don't have COVID. There's a 20 to roughly 40% chance that the swab just missed getting viral material in that testing episode. And so if you have a negative test and you have symptoms, we still recommend that you behave as though you have suspected COVID regardless, and that you follow the CDC isolation guidelines regardless of having a negative test. And so we'll get to the isolation recommendations in a little bit here. Now, there are a few other forms of testing that you may have heard of. So there's this rapid test that looks for the actual virus antigen and can be done with blood or maybe saliva. We don't have that available. That may become more used even in a household setting as we move forward through the next year. For example, to let people safely go to school. You would literally test yourself every day or once a week, and it would just help us be safer about doing congregate activities like school. And then we do have a rapid in-house test, which is also PCR based, and it looks for genetic material, and it's a nose swab. And we have limited supplies for that at this time, and so we're saving that test that does result in an hour or two for our very sick patients or patients that need emergency surgery. And we hope to improve the number of rapid in-house tests that we can run in the next month or two. We're purchasing an additional lab machine to help us with that. And on average right now, so if you get a normal community test run for COVID concerns, that swab is sent out to a private lab that runs the swab through its machinery, and the result will be available within approximately 2 to 4 days. Our nurses are working hard to call with results when they become available, even on weekends at times, especially if there's a positive result. And then there is, of course, antibody testing, which is a blood-based test, and it looks for acute antibodies, IgM, and persisting long-term antibodies, IgG, to the novel coronavirus. This test has a lot, it's very unclear in general of how this might be useful. It's best done about a month after acute illness, because that's when you're going to have the most antibodies in your blood. And what we're seeing is that if people have relatively mild illness, they may not produce many antibodies at all. If they have more severe illness, it's more likely they're going to produce more antibodies. And we don't really understand what level of antibodies you need to have lasting immunity against the novel coronavirus, or even if there will be lasting immunity. It seems more likely that there'll be some element of temporary immunity that could be months to even a year, roughly, and then you might be susceptible to the novel coronavirus again. And we think that because that's how other forms of coronavirus behave. For example, young children maybe would get a different form of the coronavirus and then be able to get it again a few years later. So it's not, for example, like the measles vaccine, where you get your set of measles vaccination as a child and then you have lasting immunity for the rest of your life. It probably won't be like that. It would be more like that you may need periodic vaccine boosters that might even be tailored to possible mutations that this virus might undergo. Kind of like the annual influenza vaccine that you get, and how that is tailored to the most predicted strain that you might see in the community for the winter. So at this time, there aren't many instances in which the antibody testing is useful for those reasons. Some people don't show anything on the test, even though they've had an infection with the novel coronavirus. We don't know how to interpret the results. So there are very few instances in which this is useful, although we do have this test available in our facility. So let's talk about a vaccine and when that might be available. There are several research organizations and pharmaceutical companies around the globe and academic institutions that are obviously working very hard to create a vaccine as fast as possible in a few different forms. There's been some discussion of trying to do a nasal live vaccine versus the shot form of vaccine that we would be most familiar with in the United States. There's some other discussion of trying to produce large amounts of just monoclonal antibodies that you would give people, and it would at least give them some level of immunity for a few months after getting a shot. Now, that's not a vaccine necessarily, but let's, in reality, any medicine that is produced for the general public has to be tested for safety. And if it's not tested for safety for large-scale use, we could harm people unintentionally. And so I have to emphasize here that producing anything that's meant for mass use medical treatments takes a fair amount of time because it has to go through several levels of testing, even if it is expedited in the FDA. And so I would anticipate that it would be surprising if we had a vaccine available by the middle of this winter, maybe more reasonably within the next year. And then the bigger issue is producing it in mass quantities that could meet the needs of the United States. And deciding who would get the first round of vaccines that are available. For example, would that be the most vulnerable and perhaps healthcare workers who are frequently exposed, grocery workers, anyone that's in a frontline situation where they're more frequently exposed. And so navigating all of that is going to take time. And like I was saying earlier, it might even be the case that you need to get a periodic vaccine for the novel coronavirus as it mutates and changes, maybe once every year or every few years, kind of like the influenza vaccine. So that will be evolving over the next several months, but I wouldn't plan on it anytime soon. Should you travel? Should you travel? So I'm actually aware of a lot of people doing domestic travel. There are some travel bans actually in place that might limit your ability to travel globally, or if you do need to travel globally or even domestically, in some instances you might need a negative COVID test prior to travel. This is all about shared decision making in your family and weighing the risks and benefits of doing something. There has been a definite uptick this summer in families that are buying campers and boats and doing outdoor activities and going on long distance camping trips to various national and state parks. And so I do think that it is reasonable to travel and take appropriate precautions with mask wearing and distancing and hand washing or sanitizing. I would definitely avoid larger group activities or crowds, such as concerts or festivals, because those can be areas of significant spread and infection. But I do think that within your immediate household group, it is probably safe and reasonable to travel as long as you're taking the precautions, at least domestically. Now, again, you also would want to consider maybe your level of risk should you come down with COVID. And if you were to end up being hospitalized far from home where you're going, traveling to, is that something that you find acceptable? So it has clearly taken COVID-19 a while to really get to our local area in Kanabec and Pine County. We've had a much slower process of spread than larger urban areas. And generally speaking, that is in part just because of the rural nature where we live. It's a lot easier for us to socially distance from each other to start with because we aren't in a crowded city where we're on mass transit or walking on sidewalks or in stores that are crowded. So that's part of it. And just generally speaking across the nation, urban areas have been hit first and harder, and then rural areas come very delayed with their infection, just like we are here in Kanabec County. And it seems as though we're actually just now entering our uptick in cases. We're having, so we've officially had COVID cases in both skilled nursing facilities in town and a few of the senior living apartments. And we're seeing the number of cases and the case rate among our population start to pick up. And so to me, it sure seems like the worst is yet to come for our area, and that this fall and winter will probably be more telling in terms of our COVID experience than the spring and summer has been. So why is the stay-at-home order so important for those that are not considered high risk? So I'll maybe change this question a little bit. So there's the masking order at this time, and then the plan ahead order, or recommendation. It's not an order that the governor's office has put out. We're not on a stay-at-home order at this point, but we might return to that if we did get in a bad statewide outbreak. So generally speaking, the behavior that all of us model ultimately affects the most at risk in our society. and the most vulnerable in our society. So the most vulnerable and at risk people in our society for having severe COVID and death from COVID can, of course, isolate at home or in their living setting. And the younger, in most cases, younger and lower risk individuals, while they may be very tempted, it might be very tempting to want to forego any of the recommended COVID precautions. A lot of the younger and lower risk individuals are, for example, caregivers for our higher risk individuals in skilled nursing facilities, etc. And so ultimately, if someone who's not high risk chooses to not follow COVID precautions and then brings infection into a setting, whether it be that they're a grocery store clerk or that they clean homes for a living or that they work in a daycare for a living, ultimately they can become a vector for spreading the illness, and that illness in the end can reach the most vulnerable and cause unnecessary death of those vulnerable individuals. And so our society needs to behave collectively in a way that protects the most vulnerable. And then just to comment, right now we have the masking order for public places, and the combination of masking and social distancing really is the #1 way to reduce and slow the spread of COVID-19 through our society and reduce transmission rates. And wearing a mask really protects others more than it protects yourself, because if you're if you have mild COVID or don't have symptoms at all of COVID but are infected with it, you have the potential to unknowingly spread it to others. And so really, mask wearing is a way to care for others and show concern for others and protect others more than it is intended to protect yourself. And now, mask wearing seems to be studies. There are several studies on mask wearing, and in general, a multi-layer homemade cloth mask seems to reduce spread approximately 30 to 40%. And again, this all matters because when you combine that with social distancing and other good precautions like hand washing and sanitizing, the overall spread is going to slow down and allow us to care for individuals who do get sick better. And so, again, taking these precautions is really a sign of care and concern for your neighbor more than it is maybe even yourself in some ways. So let's talk about COVID exposure, isolation, and quarantine. So the CDC defines COVID exposure as a close contact exposure with someone who you've spent more than 15 minutes within 6 feet of. And then there's a few other behaviors they list too. For example, had you given them a hug, had you shared a meal with them, had you kissed them, so there's some other things too that would be a little higher risk even if it wasn't for 15 minutes. But, and then of course, if there's anyone that you share a household with, that exposure is very real. And once you have COVID in a household, it's very likely that other members of that household will indeed become positive for COVID-19. So if you have had an exposure, whether it's in the workplace, in the community, in your household, and you have no symptoms of illness, you would quarantine yourself for 14 days from the last day of close contact with that individual to see if you develop symptoms of COVID-19. And then if you do, of course, we would test you for COVID-19. And if you don't develop any symptoms, ideally you would get tested at the end of your quarantine period to see if you have turned positive and are an asymptomatic carrier. If you end up being diagnosed with COVID-19 and you have a positive test, then you'll switch to doing what's called isolation. And the CDC recommends a 10-day isolation period at the least for people who have COVID-19 diagnosed, and that they can then come out of isolation after 10 days if you've had no fever for 24 hours and you are clearly feeling better. Now, where it gets really tricky is if you have COVID going through a household. The CDC has kind of extensive recommendations regarding isolation and quarantine in those instances. And the most important thing is, in a household, if you have a positive individual, if that individual cannot isolate themselves fully from the rest of the household members, it really affects the length of time that you're going to be in quarantine. And all those details can be found on the CDC website if you have more questions about that. So let's talk a little bit about preventative care and why it's very important. Generally speaking, as an ER provider, we saw an uptick and are still seeing an uptick in how sick people are when they're coming into the ER. More frank heart failure, more uncontrolled diabetes, more people are just sicker when they're coming into the ER since COVID-19 has happened, even if they're not sick with COVID-19. And I think this speaks to this idea that people are maybe not going to clinic to manage their chronic diseases like high blood pressure, kidney failure, diabetes, as regularly as they should be. And so I cannot stress enough that improving your overall general health and taking care of your overall general health can only help you if you should get COVID-19. So please take care of your chronic illnesses, get your annual vaccines, and in particular this winter, it will be very important that people get their influenza vaccine, because should you a lethal combination and have even higher death rates than just COVID-19 alone. And so we will be offering curbside influenza vaccinations coming up here. So please check our website for more information about that. And then also, just speaking to well child checks, there's been a lot of concern among family medicine providers and pediatricians across the nation. We saw a large fall off in routine well child checks since COVID has happened. And again, what this means is that there's a large number of children who aren't having their developmental screenings like they should, and are not getting routine vaccinations for things like measles like they should. And so the last thing we need as a nation right now is to end up with a measles outbreak because we are not being fully vaccinated as a society on top of dealing with COVID-19. So again, bring your family in for the routine care, including well child checks for kids. And then I'll just leave this slide up and talk a little bit more about some other things that I've seen just having managed home COVID patients. So in general, I've seen COVID in many flavors among the 35 patients that I've managed. So I've managed basically from nearly asymptomatic to mild disease to severe disease. I've had to have approximately 5 patients go to the hospital if they did develop severe disease. And the bulk of my patients that I managed were probably over 50 years old, had a few risk factors for severe COVID, and ended up with moderate severity COVID, and they felt very sick and under the weather for about 2 weeks straight. And that was a really frustrating experience for them. This illness is not something to take lightly. My impression of it is that compared to influenza, for example, influenza people maybe would be intensely ill for 4 or 5 days and then recover quickly. If you get moderate, medium COVID or severe COVID, your illness is very prolonged, and the recovery period can be very prolonged. We're talking weeks, even months. And there's even some evidence of long-term sequelae or lasting effects of COVID that can be neurological or heart damage based and lung damage based. And so, a few of the patients that we did have hospitalized came home on new home oxygen for several weeks. And actually in our small hospital, I believe that we've cared for 3 COVID patients in our hospital. We are trained and ready to care for COVID patients. We do have access to the medicines that do have proven benefits so far in the research for COVID. And let's talk a little bit about that. So right now there's evidence behind remdesivir, which is an antiviral, dexamethasone, which is a steroid, and convalescent plasma, which is plasma taken from someone who's a COVID survivor and given to someone who has acute COVID illness for the antibodies. Now, all of those treatments are only useful for people that are seriously ill and needing supplemental oxygen, and they reduce death rates and they reduce maybe length of hospital stay or severity of illness only slightly. They do not cure someone, so to speak. And so if you're having mild to moderate COVID and aren't needing hospitalization, beyond supportive care like hydration, Tylenol, ibuprofen, and monitoring your oxygen levels and doing home positioning to help you breathe, there's not any other treatments that we would necessarily give you. And should you get COVID-19, the number one thing you can do to help yourself at home and make sure you're safe to stay at home is to monitor your blood oxygen levels and keep a log of your illness every day. On average, if someone does need hospitalization, it's going to happen during that second week of illness. On average, it's day 8. But again, I would really watch anyone who had moderate COVID. I would follow them through at least 14 days of illness. And generally speaking, it seems like people present for hospitalization that I've worked with anywhere from day 8 to day 12. So really pay attention as you go through your illness. There's the first week of illness and then second week of illness, and the second week of illness seems to really matter because that's when you get the runaway inflammatory response that ultimately kills people. It's not the acute viral infection during the first week, it's that inflammatory response and the cytokine storm during the second week. So keep a log of your symptoms, keep a log of your temperature, keep a log of your oxygen levels. With a home thermometer, I have seen many COVID patients who have a low-grade fever for days, easily 2 weeks straight of 100 to 100 to 101 on average. And then at home, if you can manage to purchase a home pulse oximeter to monitor your blood oxygen levels, that is the number one thing you can do to help you or yourself, or to know if a family member is safe to stay home if there's any element of shortness of breath. If your oxygen level is above 95%, that is very reassuring and very, very normal. If it's above 90%, you should be followed virtually by a clinic provider without question. And if you dip into the 80s and you are persistently in the 80s for an oxygen level, you need to be seen by a medical provider. And that's specifically for adults. Children, we would expect to see even kind of higher. We would expect them to be above 95% nearly all the time. And so that would generally be a recommendation for adults. And just a little bit more on testing. At our facility, I believe that we've run approximately 2,500 COVID tests since we started doing our community testing initiative. And again, we're proud and happy to support the community in this endeavor. Ultimately, the more we can test, the safer we're going to be as a society and the more normalcy we can have in living our daily lives. So I'm going to close the PowerPoint here. And there's just a little bit more about myself. So thank you for listening. Thank you for your time. Thank you for your patience with us in our preparations for COVID-19. We are ready to care for you. We have our policies and procedures in place to do things safely. We are able to offer almost all normal routine cares at this point. In fact, essentially it is normal, excluding a masking requirement, doorway screening before coming into the facility for temperature, for fever and symptoms, and then maybe some restrictions on visitors. But we are here for you and we're ready to offer you care. So please reach out and let us know how we can help you. Thank you very much.